Induced first trimester abortion and risk of mental disorder. Definition. Induced abortion is intentional termination of a pregnancy before the fetus can live independently. An abortion may be elective, based on a woman's personal choice, or therapeutic, to preserve the health or save the pregnant woman.
Guided by ultrasound, the abortionist grabs the baby's leg with forceps. The baby's leg is pulled out into the birth canal. The abortionist delivers the baby's entire body, except for the head. The abortionist jams scissors into the baby's skull. The scissors are then opened to enlarge the hole. The scissors are removed and a suction catheter is inserted. The child's brains are sucked out, causing the skull to collapse. The dead baby is then removed.
Application in medicine. Concern has been expressed about the potential harm to women's mental health in association with having an induced abortion, but it remains unclear whether induced abortion is associated with an increased risk of subsequent psychiatric problems.
There have been contradictory studies in the past done on the long-term and short-term effects of having an abortion, what sort of effects it has physically and mentally on women. They tend to be somewhat contradictory, but now we have data. This is coming from the Advancing New Standards in Reproductive Health group, which is in San Francisco. Now, they took data from 956 women who sought abortions at 30 different abortion clinics around the U.S. Now, some of them were able to have abortions. 182 were actually turned away for various reasons. Perhaps they're too late in the pregnancy, things like that. Now, you should understand that these women came from very different sorts of economic situations, but that it's fairly even between the two. There's not a huge gap economically between the women who had the abortion and who didn't. And so then, after identifying these women, this organization was able to follow them and find out what happened to them. And so we have some data on that. In terms of mental health, they found that there were no mental health consequences of abortion compared to carrying an unwanted pregnancy to term, and that later abortion is safer than childbirth. Women who carried an unwanted pregnancy to term are 3 times more likely than women who receive an abortion to be below the poverty level 2 years later. So that's an economic and social effect. But yeah, a lot of people worry that after having an abortion, women are going to be mentally traumatized. And there is some very short-term, like feelings of sadness or guilt.
But there's overall relief, actually, they found.
Exactly. Yeah.
The overall feeling was a little bit of guilt, but the overall feeling was one of relief. And the overall feeling for women who were turned away was of stress, and realizing that they were now stuck in a situation that they either physically, emotionally, or economically knew that we're not going to be able to handle.
And yeah, so we have some other data about what happens after having the child. One that I thought was interesting was that women who are denied an abortion, which seems to imply that they don't necessarily want to have the child, as you see here, only 11% a year later had put the child up for adoption. 86% had kept the child. And so even when they were ready to have an abortion were denied, they tend to keep the child. And so we've talked a bit about the mental effects, but the effects, I think, in terms of the life situation of the women after getting it denied, I think that's really interesting. So
pros and cons. Pros, there is the risk for the mother, social economical factors, baby's defects and complications, mother's mental health and physical health. In the cons, crime and legal issues, religion criticism, mother's health during the procedure, guilt and infertility.
Life is the period between the birth and death of a living thing, especially a human being. So what if someone comes along and takes that away from you? Like if you're a murder, the unlawful, premeditated killing of one human being by another. Or if you haven't even been born yet, that's called abortion. The ending of a pregnancy before birth, which results in an embryo or fetus. Since the legalization of abortion in 1973, over 56 million unborn children have been killed. That's more than the entire population of Spain. That's 155 babies per hour, about 1 every 24 seconds. By the time you finish this video, 4 or 5 more innocent lives will be lost.
Abortion in Ecuador. An abortion performed by a physician, there's 3 conditions that it can be okay to get an abortion. The first one is if it has been provided to avoid danger to life or health of the pregnant woman, and if this danger cannot be avoided by other means. Second, we have if the pregnancy is a result of rape, and third, we have if the pregnant woman has a mental disability. In the studies, the methods they conducted a population-based cohort study that involved linking information from the civil registration system to the Psychiatric Central Register and the National Register of Patients. The information consisted of data for girls and women with no record of mental disorder during the 1995 and 2007 who had a first trimester induced abortion or a first childbirth during that period. The results, the finding that the incidence rate of psychiatric contact was similar before and after a first trimester abortion does not support the hypothesis that there is an increased risk of mental disorder after a first trimester induced abortion. Concluding with this, most women do not experience psychological problems or regrets about their abortion 2 years after the abortion, but some do. Those who do tend to be women with a prior history of depression.